Anesthesia. Question. Advantages of general anesthesia except A. Allows proper muscle relaxation for long time. B. Can induce physiologic fluctuations that require active intervention. C. Facilitates complete control of the airway, breathing, and circulation. D. Reduces intraoperative patient awareness and recall. Question. Advantages of general anesthesia except B. Can induce physiologic fluctuations that require active intervention. Question. Severe depression of the CNS vasomotor center, respiratory center is seen. A. Stage of analgesia. B. Stage of excitement. C. Stage of surgical anesthesia. D. Stage of medullary depression. Question. Severe depression of the CNS vasomotor center, respiratory center is seen. D. Stage of medullary depression. Question. Common preoperative medications used orally. Ranitidine, atropine, metoclopramide, scopolamine. Question. Common preoperative medications used orally. Ranitidine. Question. Risk factor for postoperative pulmonary complications except age greater than 30 years. Surgery on upper abdominal and thoracic area. Presence of obstructive sleep apnea. Poor exercise tolerance or poor general health status. Question. Risk factor for postoperative pulmonary complications except age greater than 30 years. Question. Common postoperative pulmonary complications are A. Pneumonia, B. Atelectasis, C. Bronchitis, D. Bronchospasm, E. Hypoxemia, F. All of the above. Question. Common postoperative pulmonary complications are F. All of the above. Question. Goals of preoperative assessment. To reduce anxiety and facilitate recovery. To obtain information about the patient's medical history. To obtain informed consent. To determine which tests are required. All. Question. Goals of preoperative assessment. E. All. Question. Normal interincisor distance. A. 5.6 cm. B. 3.6 cm. C. 3.8 cm. D. 4.6 cm. Question. Normal interincisor distance. D. 4.6 cm. Question. Irregular respiration as well as vomiting is seen. A. Stage of analgesia. B. Stage of excitement. C. Stage of surgical anesthesia. D. Stage of medullary depression. Question. Irregular respiration as well as vomiting is seen. B. Stage of excitement. Question. Which one is false about the risk of anesthesia? Risk of anesthesia-related cardiac arrest 1 in 10,000. Risk of anesthesia-related mortality 10 in 40,000. Risk of minor complications due to anesthesia for children 112 years old 1 in 1,000. Risk of anesthesia-related mortality 1 in 40,000. Question. Which one is false about the risk of anesthesia? B. Risk of anesthesia-related mortality 10 in 40,000. Question. Preoperative phase include except preoperative evaluation, choice of anesthesia, premedication, physiologic monitoring and vascular access. Question. Preoperative phase include except D. Physiologic monitoring and vascular access. Question. Which one is not included in anesthesia postoperative phase care? Patient outcome. Postoperative pain control method. Choice of anesthesia. Anesthesia complications. Disposition. Question. Which one is not included in anesthesia postoperative phase care? C. Choice of anesthesia. Question. Preoperative form include general data of the patient, history, physical and laboratory examination, anesthetic plan, consent for anesthesia. All. Question. Preoperative form include F. All. Question. Which one is true about diabetes mellitus? A. Perioperative morbidity and mortality are lower in diabetic than in non-diabetic patients. B. Adequate control of blood glucose concentration, 180 mg/dl, must be established preoperatively. C. Oral hypoglycemic agents are withheld the day of surgery for an agent with a long half-life and up to 72 hr. D. No need to maintain blood glucose concentration, 180 mg/dl, until oral feeding is resumed after operation. Question. Which one is true about diabetes mellitus? B. Adequate control of blood glucose concentration, 180 mg/dl, must be established preoperatively. Perioperative morbidity and mortality are greater in diabetic than in non-diabetic patients. C. Oral hypoglycemic agents are withheld the day of surgery for an agent with a short half-life and up to 48 hr. D. Blood glucose concentration, 180 mg/dl, must be maintained until oral feeding is resumed after operation. Question. Regular respiration to apnea is seen. A. Stage of analgesia. B. Stage of excitement. C. Stage of surgical anesthesia. D. Stage of medullary depression. Question. Regular respiration to apnea is seen. C. Stage of surgical anesthesia. Question. Ultimate goal of preoperative assessment. To reduce the patient's surgical and anesthetic perioperative morbidity or mortality. Return the patient's normal function as quickly as possible. Both. None of the above. Question. Ultimate goal of preoperative assessment. C. Both. Question. Order of the stages of general anesthesia. Stage of medullary depression. Stage of analgesia. Stage of surgical anesthesia. Stage of excitement. 1, 2, 3, 4, 5, B2, 4, 3, 1. C2, 4, 1, 3 D.2, 1, 4, 3. Question. Order of the stages of general anesthesia. Stage of analgesia. Stage of excitement. Stage of surgical anesthesia. Stage of medullary depression. B2, 4, 3, 1. Question. What is anesthesia? Loss of consciousness with or without loss of sensation. Loss of sensation with or without loss of consciousness. A state of loss of consciousness. None of the above. Question. What is anesthesia?